our first meeting of 2021. We're really looking forward to this conversation. We have two great speakers today and a couple of discussion questions that we've actually been able to take from the group through our Google form. That's something new that we're trying out. If it's something that you're interested in, we can definitely keep doing that as well. We also have some updates that we're really interested in getting out to you guys, and hopefully some announcements from you as well. So I'll just go ahead and get started. So today our discussion is specifically going to be around the COVID vaccine, thinking about how can we really work towards true equity in outreach and distribution. Our team has been sitting in conversations around thinking about these ideas with a number of different partners, and we really wanted to make sure that we had a chance to hear from you, had a chance to continue this conversation among the different organizations that you all represent as well, to really think about what are the best ways to really think about outreach and distribution methods that are specific to understanding Chicago's historically the trauma that lives within his neighborhoods within Chicago, thinking about ways to be equitable and to really share education in a way that really thinks about all the populations that we're trying to reach in an equitable way. So first up, we're really happy to have with us today Vanessa Stokes. Vanessa is a consultant at VS Creative Consulting and is a project coordinator with Austin Neighborhood Stabilization and Austin Coming Together. So I will hand it over to her now.
Hi, everybody. I actually am not at Austin Coming Together anymore. Yeah, so I'm just gonna first share with you who I am. Thank you for inviting me today. So I live on the West Side. I'm a West Side resident, and I work on the West Side. So I started working on the West Side, just volunteering. And when I first moved here, my family has been here for about 20 years. So I moved in with them. And I initially wanted to work in the maternal child health field. I've been a breastfeeding peer counselor for many years. So I'm very well-rounded about health education and educating women about how to feed their babies and, just being new moms and whatnot. So initially I wanted to do that work. It was really, it's really hard in the medical field. I also used to do rounds on the maternal child health floor at John Stroger, and I did that for a while. And, I have a lot of experience in just the health field when it comes to mothers and babies and whatnot. So, when it comes to like vaccines and all these different new ways that are now being, I guess you could say people are now are more aware of it because of COVID. And because of the, work that I'm doing in the community, I think this is a really great time to really talk about education. And so the work that I'm doing now, I now work as one of my clients is the Special Service Area 72. So I manage a business district in Austin, and I also work with a bunch of different organizations in the community, mainly doing arts organizing on Chicago Avenue. So now here we are with COVID, and I did do this Block Club Chicago. I was asked to comment about the vaccinations, and I think that we have a lot. I think one thing that we really got from all of this is that we got a lot of work to do when it comes to educating people. There's a lot of misinformation about the vaccination. I think that kind of you could tell there's some gaps that we need to fill there, right? Like we need to fill these gaps, information, and I think that this this is the right time to do that because, because of this virus that we do have. So that's a little bit about me. Sorry, I feel a little unprepared this morning, but I just wanted to share a little bit. And and I don't know if we could take any questions, or if you have any questions that you want to ask me, I can answer to the best of my knowledge.
Thanks, Vanessa. This is Jess from IPHI, and we really appreciate you joining us today. What we'll also do is we'll have Dr. Walker introduce himself as well, and then we'll pull up the questions that have come in already, so that you both can kind of get a sense of some of the questions that have been sent in advance. And then, as you said, we'll open it up to discussion with the audience, but we just really appreciate your willingness to join us and as you said, share from your expertise over many years and working on in all of these issues. So thank you so much. And Rebecca, go ahead.
You're welcome.
Sure, yeah, and I also just echo everything Jess just said. So yeah, now I'm happy to introduce Dr. Garth Walker. He's a Deputy Director at the Illinois Department of Public Health, and he's Assistant Professor of Emergency Medicine at Northwestern Feinberg School of Medicine. So I'll hand it over to him now.
Hello, everyone. Thank you for inviting me today. I really appreciate taking the opportunity to share with you my experience, as well as some of the things that we are doing at IDPH in my office. So my name is Garth Walker. I'm an emergency physician. I still see patients, mostly at the VA. I'm an assistant professor at Northwestern, as mentioned, and deputy director at IDPH, where I lead the Office of Men's Health, as well as help with some of the vaccine distribution. My journey throughout this whole cycle has been both emotional, but also a vantage point of seeing it from the research, clinical, and now the public health side. And right now, a lot of our efforts, my office has been engaging vulnerable communities, addressing some of the issues that may be related to vaccine apprehension. And understanding what those issues are, but also trying to move people towards a comfort level where they feel like they can make an informed decision, because it is a personal decision, because it affects each of us differently. Additionally, looking at the numbers and trying to get our move the needle towards restoring our communities, especially under most disinvested communities that have been impacted by the virus, and hoping that we can not get to a position where we're like this again. So I'll stop there, and before we move to questions, and pass it on to whoever else is next to talk.
That's perfect. That's perfect. Thanks so much. So we did get a number of questions in from the Google form, and our team has also come up with a couple questions. But we did actually just want to leave the space open right now. If there are any specific questions that anyone has related to the vaccine, related to equity, thoughts about distribution, thoughts about really like making sure that we're that are specific to Chicago, or anything else that you would like to ask our panelists, we're happy to hand the floor over to you first. Oh, and also feel free to use the chat box if you don't want to come off mute. Okay, so we can start with one of our first questions. So how can we make sure tiers 1B and 1C are being held accountable for distribution?
I guess I could attempt that question really quickly. I think one of the challenges is that there are already a lot of structural issues in place right? Geography, income, digital comfort level, digital divide throughout this city, and is thinking about how we can be as intentional as possible, how actionable as possible in terms of engaging vulnerable communities during these times. And then also recognizing the overall context of how our messaging works, and ensuring that we're not blaming people and or forcing people to take the vaccine. So our approach has been to get the facts out, provide the overall context of how it's affecting our communities, and demonstrate kind of what the vaccine means in that very context. And what we've been doing is a lot of town halls, partnering with trusted messengers, faith-based organizations, community-based organizations, fraternities that have huge footprints, and sharing the science behind the vaccine, and then also providing information in terms of what phase we are at, who's eligible, and then giving an expectation of when that subgroup that's predominant to whoever that we're talking to will be eligible. And we've had good results with that thus far, but it's a marathon. We're not going to necessarily solve it overnight, but we have to be very cognizant of the structural issues related to communities of color, migrant communities, and throughout the state of Illinois as well as Chicago, in order to be able to optimize our ability to deliver vaccinations to our most vulnerable groups.
I'd like to kind of expand on that answer. So as a resident of Chicago, as a Black woman, as someone who doesn't vaccinate their children, so I don't vaccinate my kids, I bring another layer of I think interest to this conversation. Now I wouldn't say that I won't ever do it, and that's something that I've gotten from this conversation and these types of conversations about vaccinations. So I'm opening myself up to what that looks like, and I'm also seeing the importance of especially those people who are high at risk to be vaccinated, right? But I also think that there's something that can be done now from the medical community. I don't know if there is space for that though, and that's really educating people on their bodies and how things work within their bodies. I don't think most people have a really good sense of really basic human anatomy. That I think that it's kind of hard to just have a conversation with people about what happens inside their bodies, right? And I don't think, just from my experience, the medical community has the time or the space to really give to that education. Now, if we could use this situation, this vaccination, this virus, as a way to educate people, I think that is a step in the right direction. And I think that also too, our expectations are really high, and I think this is where the equity really needs to come in. We need to just find ways to really educate people about the basics, like just really basic stuff. Folks don't have that education; they don't really get it. And I know this from working in hospitals and talking to mothers about like really basic stuff, like you're taking high blood pressure medication and you just had a baby, and you don't even know the medication you're taking. You don't know the name of it. You don't know what it does to your body. You don't know anything. And I ran into that a whole lot. And so I would spend time with these patients and talking to them about just the importance of them to really understand what happens, just the normal human body and anatomy and what happens to the body. And they got a lot from those conversations. So I think, you know, if the medical community can find a way to just educate people and then build those relationships in through that education, build relationships with especially with Black people. Black people do not trust the government. They don't trust hospitals. They don't trust doctors. They don't. And I think that this is a great time for us to really build on that. So that's my 2 cents.
Well, I just want to also add, and I want to thank you for sharing your story, because in that story, it gives me hope in terms of whatever that we're doing, all the talks that we're doing can move the needle, because we know that people are at different spaces, right? Some people might be completely closed off, not necessarily want to hear about the vaccine. But maybe after hearing about some of the science or hearing about some of the stories, they might be able to move to 40% or 50% or 60% towards taking the vaccine. And I think that's really how you earn trust, the persistence and the revisiting to just give the truth of what the risk and benefits are with the vaccine. And I don't want to necessarily use this as a marketing tool for our office by any means, because there's so many people and we need so many people doing this work. We need so many people going out and talking and explaining what the science is. But generally, when we do these town halls, it usually starts with what the science is, and then how it's affecting Black and Brown communities, and then also addressing some of questions around what is the historical context and how does this relate to some of the atrocities that have happened in the healthcare system. And I think we've been able to have a lot of productive conversations around that, but also just demonstrating just what the risk and benefit of just getting a vaccine. When your kids get a vaccine, how much similar is that to your day-to-day activity? For example, pediatric vaccines can be just as risky as just walking out of the door and going into your car. Some of the most mundane things that we do on a day-to-day basis. And then also explaining the safety and development of the science to the vaccine. And juxtaposing that with what we're seeing in the ER and also the communities. Because I personally think that the vaccine is a step towards our ability to restore our communities and be able to open back up our economy and start living and loving each other again, and be able to hold people such as myself, the state, or other individuals accountable to avoid from getting into these situations again, where there's the structural drivers are just so stark, so strong, that positions vulnerable communities in a much more difficult position when a pandemic hits. I'll stop there.
This is Jess, and I just wanted to highlight a couple things that I heard from both of you that were, I think, really important insights that maybe don't get lifted up enough in these conversations. So Vanessa, a couple of things that you raised, but one that stood out to me also was, I think that there really is an opportunity to figure out how to build more of a community health workforce, or a workforce in community-based organizations that that we need going forward around community health, which our healthcare system in the past has not really, funded or valued probably at the level that it needed to be. So I think that's a real opportunity, and I just wanted to tie that. I think a number of people may know this, but in the Illinois General Assembly this upcoming session, there will be a bill related to reimbursement for community health workers. So I think there's some opportunities around sustainability for the community health workforce that can go beyond this moment. And I think the other thing, Dr. Walker, that I really appreciated that you mentioned, and I'm curious if you have thoughts about how we leverage this moment, because we know that, yes, there's an opportunity for education in the community, but there's also a real opportunity for education among the healthcare provider sector around structural issues and how we as healthcare can address structural issues and how we have to take structural inequities and historical inequities into account in the way that we do our work. So I am curious sort of how you see that we can leverage this moment to really increase the education and understanding from the healthcare perspective around how we address structural inequities in our work.
That's a great question. I think it has been an opportunity for people to get a lot more comfortable with the term structural racism. What does that mean? What are structural drivers? Explain to colleagues that may not necessarily use that in their everyday language. And after you explain it, it becomes a little bit less jarring, right? Because when you're speaking from around structures, you're typically thinking about policies that either had intentional or unintentional consequences of exacerbating disparities. I think it's been a valid opportunity to discuss with colleagues and peers just how some of our most mundane clinical decisions exacerbate healthcare disparities. And then the role that I have colleagues that will probably say our role is to diagnose and treat. And they may not necessarily think of healthcare as holistically as where you live, the housing that you have, your job, your ability to gain access. So I think, to your point, the pandemic has really invited that opportunity for people to understand the value of these issues and to be able to provide a structure where they incentivize physicians to investigate this a lot more, as well as solutions from an academic side. But also, I've seen private-public partnerships that have come up to address these issues a little bit more head-on and put a lot more resources towards those issues.
Hey, Jess, this is Lisa. I just wanted to piggyback on that response on your question. I think another concern I have is how do you do all of this, knowing that it has to be done quickly, but we never have asked the questions that we're asking now until now. Like we've never addressed it until now, but we have a pandemic and we have concerns, and we don't have any data because, quite frankly, we've never asked. And to Jess's point, I think structural inequities and Dr. Walker, that this is news for a lot of people. Like they never knew that this was concern. Like this was news for a lot of like white providers that this was an issue. So now that everyone knows it's an issue, what do we do to make the things expedite, but doing it safely and doing it correctly as well?
I think a lot of so in terms of communications, we've been structuring a lot of call to actions. So if you're comfortable with that you've taken the vaccine, tying it to like a social media or making it more of a communal event. But that also requires that person is ready. But I also want to make sure that we stay away from the notion of victim blaming, because it's really a sensitive topic, particularly when you talk about communities that are rightfully apprehensive to take a blind recommendation from the healthcare community. But what we're trying to do is unblind that, right? We're trying to provide the science, the data, let people know who are the stakeholders at play. From an institutional standpoint, I think part of it is capitalizing on a lot of the spikes that we've probably seen externally, right? That have shown that disparities exist and it affects groups tremendously, and trying to make sure that leaders are acting on that. That's what I've observed has been some of the more effective short-term plays. From a long-term, I think people really have to be committed to not necessarily just speaking about diversity, but recruiting diverse leaders in diverse roles. It doesn't have to be the chief diversity officer, but just making sure that you have a diverse set of leaders that can think holistically about what are some of the risks affecting different communities. And for a short term, that you can't necessarily hire people right away, but there'll probably be a lot more consulting and making sure that you're covering your bases and thinking about what equity really means and how we are preparing for that. Because you have to be prepared at minimum. It may not come out the way that is intended, but people have to be prepared. And I think if you're not, especially during this time, there won't be really any time in our at least during my lifetime, where I've seen where people would be able to do that.
I wanted to share something. So what I'm really hearing is like we're really not prepared, right? Like we weren't prepared for a pandemic. And now that we're in it, what are we going to do, right? So, I think I think everything that's come out about the structure of America, this is a really great time for us. It's a really great time for us to grow and to thrive as human beings together. But there's some healing and there's some reconciliation that really has to happen in order for us to move forward. And I think these types of conversations are the ways that we move forward. And it's going to take some time. I think it took us hundreds of years to get here. Hopefully it won't take hundreds of years for us to get out of it. I don't think it will. I don't think it's going to take a lot of time, but it's going to take some time because people are dealing with, generational trauma, and it's going to take some time for us to really heal from that. So, if you're looking at it realistically, I think that these conversations can really bring about the transformation that we're all looking for. And then once we do that within ourselves, it is our duty to go out and to do that with other people, especially white people. Once white people get it, it's their duty to go out into their families, into their own communities to help stop this. And so we can all move forward. So, and I know that it's scary, it's really uncomfortable because you got to look at yourself and you got to say some things to yourself that maybe you don't want to say, maybe you're hiding from, but we're all human. We all do that. Everybody does that. So I think that once we really see that what it is that we all want is really all the same thing, we all want safe communities. We all want to be with our families. We all want to take vacations and all of these things. Everybody wants that. They want secure jobs. They don't have to worry about bills. They want to have fun with their families. Everybody wants those things. But it's what Dr. Walker said. It's these structural things that are holding us back. And we have to just we have to change it and start all over. And that's also scary. I think for a lot of people, change is scary. But unless we change, we're going to stay the same. And I'm thinking for a lot of people, these kind of conversations are refreshing. They're ready to take on whatever it is that they see. So
Thank you so much, both, for sharing your thoughts. And thank you again, Lisa, for that question. I want to switch to one of the questions that came in from ahead of time on the Google form. What would be some of the best practices for toolkits around COVID vaccine messaging?
So we've done a lot of focus groups and in terms of throughout the state as well as within the city in terms of best practices. And with respect to messaging, where we've seen our most success is acknowledge, you have to call things out, right? What people have a right to be apprehensive. So when that comes up in discussion, we have to make sure that we acknowledge that. But we also what we've also been trying to do is describe the overall context and why this is important, and what each step of vaccination, masking, distancing, and washing hands really means, and how it's not just protecting yourself, but there's a social benefit of helping your family, helping your neighbor, helping your friends and family. That you're reducing transmission, you're moving the needle closer to when we'll be able to open up jobs, get to open up restaurants and things of that nature. We've seen success in terms of framing it from that perspective. And then we have an ambassadors program where we enroll people, started by Juana Ballesteros at IDPH, and we share just basic information, infographics, facts about the COVID, and where we are currently in the pandemic. And then we also share vaccination info in terms of eligibility, as well as where you can get vaccinated and when you can get vaccinated, because we have to set expectations, right? Right now it's 65-year-old and older and essential workers, and obviously once it gets to 1C, they'll be expanded, and then 2 will be for the general public. But it's a combination of knowing your audience, setting expectations, and providing information on how to be actionable.
Just one quick question, and then I don't want to interrupt Vanessa, so that you can share your perspective, but could you clarify the work that Juana Ballesteros is working on? Who registers for that? Is that individuals, or is that something that providers or community organizations can be a part of as well?
Any community organization can be a part of it, and I can share it in the chat soon in terms of how to engage Juana and register for it. Right now, we have roughly about 500 people, 500 groups across the state, and it provides a lot of good information for people to serve as partners in terms of messaging and things of that nature, and also provides latitude in terms of adapting to the community that you may know more than us, right? It may be, some of those small things that you just know from growing up within the community that you may be affiliated with. But I'll definitely share that, probably an email afterwards, so that it can be disseminated afterwards too as well.
Vanessa, did you have additional thoughts in terms of messaging and how, if providers or community organizations are working on a toolkit, some of the key ways to think about messaging in that work?
Well, I do know on the West Side, we do have West Side United, which is a group of hospitals in the Illinois district that are working with West Side residents to look at those social determinants of health. And I do believe that they are in the process of creating some sort of information to share. And look, like as someone who works in the community, and in the largest community in Chicago, so Austin is the second largest in population and the largest in area. So there's almost 100,000 people that live in Austin, and Austin had some of the highest rates of COVID deaths, right? So, in the information is just really not getting to the people. And this is something that we've, as a community, groups of us are seeing that. We're seeing that we need a better connection to the people in the community. And I think that, community health care workers would be amazing to build those relationships with people in the community, to help bring about that education, that peer-to-peer kind of conversation and contact, I think is very powerful. And I know that there are some providers that do that on the West Side, and they have had a lot of success in how to really build relationships with the community. And I think that those are the ways that we really get this information out to people. But like I said, this is not an overnight thing. It's going to take time. It takes time to build relationships with people. The West Side is a challenge to build relationships with folks. And so it takes time to grow those relationships, to really trust each other. So I think those are the things that we really need to focus on, is like, how do we build relationships with people in the community? I think infographics and toolkits are great, but if they're not getting to the people, then what's the point? So we got to work on these types of conversations, these types of ways of being real and authentic with people, so they can open up and accept certain things and be open to different types of information. And I think we're at that point. I think people are open to it now. I think people are really wanting to know what's happening. And I think, like I said, this is the perfect time to just get in there and get that information to the people.
One thing I'll also mention to folks, and I know a couple of you were on the call this morning, I think for the city of Chicago, most people are aware that the mayor's office announced this Protect Chicago Plus initiative, in which 15 community areas have been identified as having been hardest hit by COVID and to be prioritized for sort of extra local outreach and relationship building around vaccine. So on the call this morning of the racial equity response team for the city, the city did share the sort of order that they're planning to roll out that initiative across community areas. So I believe that will be shared publicly soon. But we'll post in the chat to make sure that everybody knows the community areas that are included there. I know that Westside United and Rush and others are involved in in Austin, and as well as the other Westside community areas. And I know several folks on this call will be involved with the Southwest and the South, but we'll send along the information because I think, to the points that both speakers are sharing, now is the time, hopefully, that our community-oriented providers and our community-based organizations can really get involved with that city effort and push towards this relationship building, because it's going to be on all of us to make that initiative really work and be the foundation for this work. And I know in the county, there's similar efforts in suburban Cook that are going on. So I don't know if there's anyone on the call that would be able to comment on those efforts in suburban Cook County, but I wanted to open that up in case there is anyone that has specific information for suburban Cook that wanted to share some of what you're doing before we move on to our next questions.
Hi, this is Stephanie Mucha from Access to Care. If those of you who don't know, Access to Care is a nonprofit organization. We're based in Westchester, but we serve all of suburban Cook County and a little pocket of Northwest Chicago. We provide primary health care to low-income families, or actually adults, connecting them with their primary care physician, pharmacy services, labs, et cetera, et cetera. Most of our population, or about 60% of our population, is Latino. We are really struggling with, what do you say to people to get them? I feel like, so I'm the public relations manager and outreach manager. And, I feel like, COVID has had the arc. First it was wear the mask. Now it's contact tracing, stay inside, know about the vaccine, get the vaccine. And getting the vaccine is this incredible, frenzied, frustrating experience for everybody. And, we were talking about, for people who are hesitant or on the fence, the ability to access a vaccine is so frustrating that if you don't really care, you're not going to keep fighting. I keep making the analogy to concert tickets. If you really want to go, you're going to go and refresh and refresh and refresh, and you're going to get those tickets. Some people don't have that opportunity. Some people don't have a computer. Some people don't you know, work at a grocery store and can't sit there for 4 hours refreshing their computer. So the disproportionality of COVID is continuing now through the access part of it, of the vaccine. So for us, we just want to make sure, I think the trusted partners or trusted messengers, I heard, is absolutely critical. We also serve undocumented population, and they don't trust the government either, you know? So I would love one grand way to have somebody trusted that people are going to listen to in a community, whether it's, you know, a Hispanic doctor, a Black doctor, female doctor, whoever is going to listen. And then we all as community partners just promote the crap out of it. You know, like I feel like while we were talking, I got something from Walgreens, and it was the CEO of Howard Hospital talking about the vaccine and what it is. And I'm like, okay, that's great, but there's so much of it, who knows what to listen to? So we are completely on board with, we will share what you say, and you know, we want to help as much as we can, but it's so frustrating to try to figure out how to give people the right information. So that's kind of where we are, but we are in support of getting the word out however we can.
No, thank you. And we need that type of motivation. We need as many people involved. And I think, as we mentioned earlier, you can't have enough cooks in the kitchen for something like this in terms of communication, engagement, things of that nature. So our department's partnering with Illinois Unidos.
SwedishCovenant.org/telehealth.
And then we're also partnering with Cook County Physician Association. So we have a log of groups of Black and Latino physicians that have offered to volunteer some time to share information with different groups. Not independent, we usually ask for a community partner, a trusted messenger in that context as well. And I think what it shows is obviously representation helps, and then also a trusted partner helps. And if you can have both on one platform, it can really get people listening, and then hopefully move people closer to a comfort level. And I'll be clear, there's going to be groups that we might not be able to reach in terms of vaccinate, but there's still something to be said about masking, physically distancing, washing your hands, and kind of repeating that information. But the goal is to try to vaccinate as many people as possible. But just because you're not willing to do that doesn't mean that we can't still continue to practice these other things. But that's just kind of an example, and I'm happy to share our information as well afterwards from IDPH.
Absolutely, that would be great. Thank you so much.
Thank you, and I just wanted to follow up on one item. So Illinois Unidos was mentioned. I don't know if there's anyone on the call who participates actively with that group. I will post in the chat the contacts to get involved with that initiative, but is anyone on the call part of the Illinois Unidos group want to share that work? Dr. Walker, is there anything else that you wanted to share about how IDPH is working with Illinois Unidos, or otherwise I can share a little bit about what I know?
So it's still very early. I was just on a call with them earlier today. So I'll be at their next meeting this Saturday, but from our departments to have a similar relationship with what we have with the County Physician Association. So we'll be setting up town halls throughout the whole state, Springfield, DeKalb County, Cook County, Chicago as well, through traditional conduits. And when I say traditional, I mean public health messengers that have good evidence behind them. So, for example, barbershops, faith-based organizations, and then just some that intuitively make sense. We have one with violence intervention programs, as well as 65 plus men's basketball league, and to provide information as well as a call to action, and then resources that are available. And that's essentially the gist what most of the information is. And the partnership is because obviously it's more powerful to have a Latino physician that can speak from the reality of growing up and having some cultural similarities that they can address a lot of those pressure points that might be the reason for people not necessarily willing to take the vaccine or may need a little bit of a nudge or just more information around what is currently going on. But that's currently where we're at right now. I did one for New Life Chicago and Little Village, partnering with one of their organizations as well, just providing information to their essential workers. But again, happy to follow up and share some information. I can share the flyer as well in terms of, as well as maybe a few point dates if this is the kind to invite people as well.
Thank you. And one other thing I'll just mention in terms of, I think some of the work that Illinois Unidos is doing that is relevant to some of the points that have come up. In addition to, really important work around trusted messengers and Miguel, who was going to join us today from Esperanza but got called away. One of the things I've heard him say, which I think is a really important insight, a lot of folks, particularly who are first or second generation immigrants have a lot of connections back to people from home. And so the information that we're receiving comes not only from our neighbors here, but from communities across the globe. And so really understanding what types of information is being spread through different social channels for different immigrant groups, I think is another insight that has been shared that is important. The other thing I wanted to mention with Illinois Unidos is I know they have a workforce work group or subcommittee that's really trying to think about some of the things you raised, Stephanie, in terms of the challenges and structural barriers that vulnerable workers face, both in terms of just directly accessing the vaccine and also related to COVID and broader health inequities. And so that is one of the areas I think that Illinois Unidos hopefully will be able to be a leader in our state, is really thinking about how we make sure that essential workers who are undocumented or have other reasons to sort of not necessarily be able to easily access vaccine will be able to access during the appropriate 1B or 1C timeframe. So that's an area of work that they have ongoing that folks may be interested in getting involved with. Rachel, I saw that you had posted in the chat about an event that Rush recently had, but I see Dr. Walker that you're gonna have to leave the call, and we knew that you would only be able to be with us for part of this, but we really appreciate so much your time and wanted to ask if there's anything you wanted to say before you left.
No, I just wanted to thank you guys all for your help, as well as all for your openness to listen, as well as a lot of great questions. It's going to take all of us together to be able to help address this very issue. It's going to take a lot of intention, a lot of patience, and a lot of persistence. So that's what we're trying to do on our end in terms of engaging Black and Latino communities throughout the state of Illinois. And any support or any ideas are very welcome. And thank you again. And I hope you guys are able to have a great conversation for the rest of the day.
Thank you so much.
Thanks, Dr. Walker. Hi, this is Rachel. Really quickly, my comment was in response to Stephanie's comment about the trusted partners and people in the community, and a lot of the mistrust. And so how to align some of that and who would be the best messengers. And so like most health systems, like Dr. Walker was talking about and others, we're doing a lot internally, mobilizing and educating internally our staff and ourselves to be better emissaries and ambassadors about the vaccine, answering questions, having providers and physicians of color on those calls to help, quote, train us to go out to the community, and not in an organized fashion that way, but to educate us to go back to our communities and our families and friends to share that information. which is one way. So Darlene Hightower has convened a number of groups together to do that, which I think is really valuable. But the other piece was about the faith-based leaders, and how a lot of the communities are very strong in their faiths and their practices, and they listen to, you know, their pastor, their rabbi, their leaders, their faith leaders. And so Rush held a kind of a large vaccine event earlier this week, basically to show that, you know, this is a trusted, and, you know, and then they've educated themselves. They asked a lot of questions prior to that event, because they understand the power and the value of having, you know, these trusted providers say, I'm willing to take it and protect myself and my family. You know, I want to make sure that you understand that it's trusted and you can do the same. So I put that in the chat just as a response to Stephanie's point, because she was absolutely right. Like, it takes everyone, but also not just providers. The providers are the backbone, but there were providers on that call who are not necessarily physicians in our meeting, who had a lot of very specific questions. And some of that, you know, some of that was helping to kind of drive some of the confusion and some of the reluctance from, you know, people out in the community and their own families. So just clearing that up was the first step, was fantastic. But then also engaging those faith leaders to say, you know, I'm trusting it. I believe in the science. I'm willing to go out and get vaccinated and show you, and come back to my parish or to my, you know, my synagogue or whatever, and say, you know, I've been vaccinated. I would encourage you to do the same. I think was very, very powerful. So that's another way of engaging the community, is to reach out to the people that the general public, that the general community members listen to and respect. So that was kind of my point of my half-baked comment in the chat.
Thanks, Rachel. I see Stephanie was asking if there was any recording available from that session.
I think there is. I can take a look and see. I'm pretty sure there was. Let me take a look. If there is, I'll put it in the chat.
Thanks.
I have a question. Does anyone know if there are any like PSAs in development? I think especially for older adults that watch television a lot, I think that would be another great way to get the message out. And I think, you know, just being a 70s and 80s kid, and, you know, seeing all of the PSAs growing up, we used to, you know, there were tons of them on TV all the time. And, you know, growing up in, you know, the drug issues of the 80s, I remember watching the PSA video in like 6th or 7th grade. And because I watched that, I never did any kind of hard drug. I swear to God, I never did it, because it scared the crap out of me. So, I mean, you know, like, what about those types of ways? I'm not saying fear mongering, but I'm saying like, what about those kind of ways to get the message to people that might not be on social media, who might not be able to get a lot of this information? Like, are there PSAs?
You know, that's a great question. And we have a health promotion disease prevention department and a program, Rush Generations, very specifically focused on our older adult population. And that was the first thing they did, was they pivoted to virtual podcasts. We were doing Ask a Doc sessions. All of those have been recorded, and those are accessible via Facebook or other things. Like you said, if you don't have social media, they're on YouTube. But they're also kind of out there in the world to help to educate, but also to encourage, you know, folks that if you have questions, here's a phone line that you can call. You don't have to have the internet or something else, but here's a phone line with providers who can answer your questions. We had a number of different other, and we're not the only ones. We're not unique. We were hearing from other partners that they are doing very similar kinds of programming, because you do have, you know, I think someone mentioned it a lot earlier, you do see that divide more starkly of folks who have the privilege and the resources and those who don't. And so we wanted to make sure that we don't rely solely on technical responses. You know, if you have the internet, you can look that up on Facebook Live. Like, we didn't want to have just a one-size-fit-all message distribution kind of plan. We wanted to make sure that if you know, if what you have is access to at least, you know, a phone, we can share a phone number that you could call and actually talk to a person. You're not going to get a recording. As far as having like a PSA or something like that, the closest we've come at Rush is just kind of those videos, those sessions, and Ask a Docs and others, and then recorded them to make them available. We haven't had like a specific kind of glossy, really great production value kind of video, but I would not put that past being in the plans, because I think that this is an ongoing, some of the topics that are coming up with COVID are coming up just in general, I think overall, about educating the community about, a lot of the different circumstances. So certainly the first start, you crawl before you walk. And the first start, of course, was just recording whatever sessions we had done live, and then making sure they were free and accessible via whatever method, and then encouraging people and distributing. Whenever we do any community work, we give out flyers. So if you don't have a phone and you don't have the internet and you don't have access to that stuff, if you go to some of our partners, we give out flyers with phone numbers or access information that to educate people about some of the topics as well. So understanding that there's not a one size fits all, but that we're trying to meet people where they are and share the information as we can. Especially populations like, people experiencing homelessness, older populations that don't necessarily use social media or technology to that level, young people, how to reach them. Yes, we are focusing more on that and not just giving phone numbers or flyers to them, because they're not going to read them, but they'll go on social media. So we're trying to meet different groups where they are.
Thank you for sharing that. I just wanted to add one thing. I think all of that is great. And I think as a hospital, hospitals can only do so much in Slurry, like inside the hospital and with their own patients. I'm looking at how do we kind of push the government into creating these PSAs, because people sit in front of their televisions a lot. I mean, everybody's still at home. They're still spending a lot of time at home. I think that, television is a really great way to share information, and get all those, phone numbers and websites where people can go to get further information. So maybe there's something that we all can do to kind of, talk to our state reps or like our congressmen, to see if the government would be willing to like create some of these PSAs, partnering with doctors from hospitals like Rush and other hospitals that are already doing the work of educating their own patients.
I love that idea. And Vanessa, right on. How many things did we learn by those PSAs in between cartoons or Family Feud or my mom watching Oprah or Donahue? I mean, that's where it happened. And I think 100%, as a PR person, but also a public health person, I'm always so like, this needs to happen. Oh, we're too small. This needs to happen. We don't have any money, and that hits. But yeah, this is Chicago. Everybody knows a guy. We know our media. Like, I agree. Get it out there, because grandma, even my own mom, they're not on the computer.
My mom is retired, okay? And she was a librarian. She worked in a library, so she knows how to use a computer. But most of the time, she's sitting in front of the TV.
Yeah.
I mean, and as I drive down blocks on the west side, I can look into the houses and apartments and have these, 90-inch TVs in their living room, right? Like, and they're all sitting around them. I mean, I think the television is a way for us to market this information to people. And I think it's really on us to like push the government, our state government, our federal government, to do something about it. Because I think that would be a really, it would help us a lot, all of us doing the work in the community, to like to support the work that we're doing. I think, and the government has access to these spaces. I think that's a really great way to get a lot of people in a short amount of time.
Yeah,
I agree with that.
They're really great conversation starters. you know, so someone who's going into the doctor or community health center or whatever is like, you know, I saw this thing during, you know, Family Feud, and it said that it's safe, and I just have some questions. Like, I worked in autism forever, and you know, just getting a nugget out there starts the conversation. We can't squeeze everything about vaccine development and efficacy and safety and blah 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 into 30 seconds, but what we can do is say enough about it to get people on board, let them know where they can go for other information. But you know, who or how much, you know, that's something we could help to figure out.
And Maureen, I think you had a comment. If you felt comfortable finishing that up, we would love to hear it.
Yeah, thank you. I was just going to say that I agree with what Vanessa said, both about PSAs, and also for me, I was kind of thinking to myself back, like when the Affordable Care Act passed and they had those navigators that helped people sign up, because, you know, on the one hand, we have this really big awareness PR campaign telling people to get vaccinated. But once people feel that it's safe and they try to get an appointment, I mean, it's a nightmare. And if you're someone older, not comfortable with technology, unless you have a younger relative who is comfortable, willing to help you, you're kind of just out of luck. And I think that's unfortunate.
Thank you so much for that. That's so important. We are getting near the end of our discussion time, so I wanted to hand it back over to Vanessa if you had any final comments, but then also open it up if anyone had any more last minute questions before we kind of wrap up this session.
Well, first, I just want to say thank you. Thank you for inviting me. I'm honored to be here as a community resident, as a lay person, as someone who, you know, has had experience in the health and maternal child health industry for over 10 years. It's great to see so many healthcare providers who are really interested in how to reconnect with community and learn how to educate their patients. So I just wanted to thank you all for the work that you're doing. It's hard work, you know, people work is hard work. We gotta get through all those layers of whatever's in the way, right? And so I just want to thank you for the work that you're doing. And yeah, I would love to connect. I'll put my email in the chat if anyone is interested. But I really want to see how we as a community of Chicagoans, Illinoisans, folks that live in this state, how can we use our own power to help this effort to continue to build on this and continue to build relationships with people. So thank you again, and I'm complete.
Thank you so much. And then also anything that's posted in the chat, we're also going to send out via notes afterwards as well. So no worries if you don't get it down now. So thank you so much for such a rich discussion. I feel like we touched on so many topics that we didn't even plan on getting to, and I really think it really brought out a really rich and true and honest conversation about some of the realities that we're facing and some of the good work that's already been done, but it really is an uphill battle, and we can't do it without continually having these conversations to check ourselves, to continue to reflect on the work that we do, and to really continue to press on a little bit harder. I would now like to hand it over to Lindsay Ehrenberg from Lurie Children's Hospital. She's going to chat a little bit more about some changes in billing opportunities around social determinants of health, specifically related to evaluation and management and monitoring changes. So I'll hand it over to her now.
Thanks, Rebecca. Can everybody hear me okay? Okay, great. First of all, I wanted to thank you very much for giving me the opportunity to share some information. I think it piggybacks nicely on the comments that both Dr. Walker and Vanessa shared about really using this moment of crisis to kind of educate us all to opportunities to make upstream or social determinant changes in the way that we, and because I'm healthcare, deal with our patients and families. So I think this is a nice transition. Just by way of context, I am Lindsay Ehrenberg. I work for the Patrick M. Magoon Institute for Healthy Communities at Lurie Children's Hospital. For those of you who don't know me, my responsibility is really helping clinicians who want to do more work in the community, because we realize that this can't be, we can't be siloed anymore. We really need to be engaging in both directions, clinicians and community members, to really help our patients thrive outside the walls of the hospital. We are, of course, a little bit unique because we are a pediatric hospital and not a full service hospital. And so we come at it from a little different perspective, but it's really, I think, now about moving from transactional changes that we're all engaging in to transformative work. And so I'm excited to share a little bit about this CMS change that has come about that we at Lurie Children's have taken advantage of. And I am not a clinician by any stretch of the imagination. I'm a public health professional. So I will do my best to put these clinical terms in public health speak. And so hopefully this will make sense to you. Those of you who are more clinically oriented, please excuse my translations because they may not be as technical as you may be aware of. So CMS is the Centers for Medicaid and Medicare and Medicaid Services. And the end of last year, they rolled out a change called Evaluation and Monitoring, or E&M changes. And what that basically means is it's a chance for providers to enhance the billing codes that they use after they see a new or returning patient in the outpatient environment. So we're talking about outpatient providing new or return visits. And what it means that is when after a provider sees a patient and are working through the diagnosis for that patient, they can alter their level of service provision that they document if they've considered a patient's social influencer of health, right? So if their diagnosis or treatment plan is at all impacted by any social determinant of health, it allows them to indicate that in their documentation. So in other words, if, for example, one of my colleagues saw a child who came in with a broken foot, and she had some mental health challenges related to living in protective custody or in a congregate care facility. And so the fact that she had been, unfortunately, taking out her stress and anxiety by injuring herself means that the doctor was thinking about the environment with which she lives and that impact on her ability to care for herself and her well-being. So by those kinds of upstream considerations, she was able to kind of document that, and that allows her as a provider to increase the level of service that she provided to that patient. So what's tricky about this is it doesn't require that you actually ask the social influencers of health questions or screen for social determinants. Hopefully it encourages you to do that. But if you think about those considerations when you're documenting a care plan for a patient, it does give you an ability to elevate the level of service you're providing. And why that's important is hopefully, and most importantly, it does a better job of providing patients with support mechanisms or resources that they may need to care for themselves. But in terms of economic benefit to the hospital, obviously, if they're getting reimbursed at a higher rate for a level of service, it has financial ramifications for the institution. So it isn't something that will bring more Medicare or Medicaid dollars to the state, but as institutions that are taking part in this, it certainly helps us increase our revenue stream, which, during this time of COVID has been negatively impacted. So it isn't really about monetary benefit, although that is certainly what's motivated our institution to implement this. But really what we're hoping is that the front and back end of the process will be mutually synergistic. So in other words, we work very hard to educate our provider community on the importance of social influencers of health or social determinant screening and why that's important to patients. But if they're thinking about that on the front end, when they're doing back end diagnosing and putting in care plans for these patients, they can also be hopefully thinking about it then, and that will have some financial benefit to the institution per se. So as I say, I think this was rolled out through our physician billing services. And so not the usual place that you see a transformational change in terms of the care of patients. But we think that it's definitely gonna help us educate our providers on the front end as well, and think about the importance of how these factors impact the patients and our ability to care for them outside the walls of the hospital. So I just wanted to share that with other people who may be doing this work. CMS, if you want more information, I can put it in the chat, but it's literally cms.gov, and you can go to their website and type in E&M, evaluation and monitoring changes, and the information will come up. There's not a lot of good stuff because they're still working a lot of that out, but it will give you the background of this. It rolls out, as I say, on the outpatient side this year in 2021. It goes into the ED in 2022, and it will impact inpatient billing in 2023. So as I say, if we can use this as a tool to really engage providers in the importance of structural determinants of health screening, we're all for that. So with that, I'll stop and see if anybody has any questions that I might be able to answer. Again, as a non-clinical, non-revenue cycle type of person, but I'm happy to kind of give any more context to how we've rolled that out at Lurie Children's.
Hi, Linz. This is Rachel from Rush. We should talk because I would love to have any tool in my toolbox that will help convince some of our providers, you know, the importance and efficacy of social determinant screening. You know, I have pockets where folks are really excited about screening and, you know, surfacing the need and having, you know, the responses or the, you know, the ability to respond to those needs that we found. And then I have some that are just simply like, I don't see the value, like it's not what we do. So anything that I could have to kind of give me an edge in that discussion would be fantastic. So we should talk.
Happy to do that. And as I say, it feels a little bit like the dog, the tail wagging the dog, in that, you know, it shouldn't be billing revenue that drives this, but to be honest, anything that leads the dog at this point in time, I'll take.
Absolutely.
And so, as I say, I think we can use this back end financial incentive for those that are reticent to do the front end work, and for the other people who are doing the front end work, it has some tangible financial benefit for the institution on top of the fact that it's the right thing to do for the patient.
Absolutely. Thanks, Linz.
Thank you so much for that, Lindsay. Oh, was there
I was
someone?
just going to ask, I think when we were talking about this, Lindsay, previously, and obviously in conversations we've had with many of you, I mean, the other opportunity area seems like really figuring out how together across institutions, we're also taking this opportunity to both screen, but also have responses or resources available for people who are experiencing these different social needs. And so I think to your point, Rachel and Lindsay, like, you know, this is an opportunity to engage more providers within your institutions actively and being able to connect their patients to resources. My understanding, Lindsay, from you is that, you know, in and of itself, the billing change, like there isn't a requirement that the provider or the institution provide a resource to act on the social need that is identified. It's just that if you are able to show that it ties back to a social determinant, then, you know, so there isn't like a specific requirement or pathway that CMS provides in terms of how does this lead to the person getting more support on that social determinant. So I think it's on all of us to figure out how to seize on this opportunity across providers and community partners. So certainly we at IPHI would be very interested in convening, you know, a smaller group to think that through, and or working with, you know, Westside Connecting other groups that have already been sort of thinking about this. So curious if anyone else, I see that Northwestern posted in the chat here, but have any other institutions been looking at this E&M billing change and thinking about how to leverage that to better address social needs among your patient population? We know this is a pretty new development, but we were curious if anyone else had, similarly to Lurie, been starting to really explore how to operationalize this.
Yeah, we're also hoping to use our IM, our information management people, to be able to kind of use this. We just happen to be simultaneously rolling out our pediatric EPIC social influencers of health screening, which Rush, I know Rachel's already started, but we're hoping that maybe it can somehow system-wide within EPIC, a back-end indication can trigger a front-end reminder to a provider to screen, or a front-end screening can remind them somehow back-end to think about this in their level of service calculations. So I think the technology might help us drive some of this. We're also integrating Now POW, as I know Rush has also done. So I think, to your point, Jess, we have to think about resource provision, and then that of course leads to the next step, which is tracking, and the constant question that we have, which is how do we show impact across institutions, because we're starting to do some of this. And I would love to think that the new partnership that Rush and Lurie has to help their pediatric populations could be a really amazing place to pilot some of these screening changes among this population, and see if we could track some of the impact of this from an evaluation perspective.
Thank you. I see someone asked whether there's a website that explains this. I don't believe Lurie has a specific website yet, but we can provide the information from CMS, which applies to all healthcare providers in the outpatient setting that can start implementing this change. So we'll make sure to include that link when we send out the notes.
Yeah, I have a really long link that I'm not, I think I can maybe figure out in the next 11 minutes how to get it in the chat. I did just put the cms.gov, and if you go on there, what you'll really find is just a fact sheet on CMS right now on their website about this change, but it is fairly detailed. We do have a lot of internal educational materials that have been developed for providers, and they had to go through hours and hours of WeLearn modules in order to be prepared for the rollout of this. But those are kind of proprietary information. I've been asking for anything that I can share more broadly that could be relevant to other institutions, and haven't come across those yet. But I will dig out this other CMS link and at least put it in the chat while you continue on with the agenda.
Thank you so much, Lindsay. And I see Stephanie's note. I also agree. It's really exciting to see how we can get creative with some of these specific billing techniques to really work towards social determinant screening and doing long-term impact measuring as well. Were there any other final questions before we moved on? Okay, if there are any questions, of course, feel free to reach out. We can help connect you and also work on providing more links as well. I wanted to take a second now. I know we're closing in on time, but just open it up to see if anyone had any announcements that they wanted to share with the group.
I can share an announcement. So one of the many community organizations that I'm a part of on the West Side is I'm on the board at the K-Rhine Center for the Arts, and it's a newly renovated 900-seat theater located on the corner of Parkside and Washington. And right now we're really working on how to continue to create these connections with the community. In November of last year, we created the Symposium on Racial Reconciliation. And we're looking at it through the lens of the Austin Quality of Life Plan. And so we decided that we're going to continue with these conversations. And so we're having our next conversation in April 1st. And you could go for more information, you could go to the canincenter.com, I believe. I'll put it in the chat. I don't remember exactly what the website is. I'll put it in the chat. But we're focusing on housing. And so I think, as one of those social determinants, housing is one. And so I think it would be great for a lot of the folks from the medical community to view it. It'll be streamed to YouTube, so you can see it there. But we're going to be talking about the historical context. And I think for a lot of people that can shed some light on why we are where we are right now. Thank you.
Thank you so much, Vanessa.
I wanted to just share, my name is Maureen, and this is my first time on this committee meeting, so thanks for including me. I'm a community health worker with Journey Care Hospice, and we are doing February 26th at 1 p.m. a virtual sort of workshop presentation for community health workers or other people who are interested in similar professions. And it's going to be focused on the 5 wishes, which is an advanced directive, planning, designating a healthcare agent, how to empower yourselves and your family members. If something happens where you can't speak for yourself and someone needs to make these decisions for you. So we're going to be doing that, and my supervisor is going to share the link in the chat. So I just wanted to share that. Thank you.
Thanks so much. If there is anything else, feel free to reach out to us at the end of the meeting, and we can also send it out to the group. And Jess, I know you had a few advocacy updates. I wanted to pass it over to you.
Sure. So we will send out after the call. The Chicago Food Policy Action Council currently has a advocacy opportunity to the federal government, to the USDA, around improving the process for the food boxes that are distributed from the USDA to a local vendor that then works with communities. So there's concerns that have been raised by both food and health stakeholders, as well as, most importantly, from the different mutual aid organizations that work across the city and county, that the way that USDA has structured that program does not really prioritize the important piece of being able to distribute the boxes in smaller quantities directly to community-based organizations. So Lucy put in the chat here a blog post that explains this issue and the opportunity to sign on. They're particularly looking for organizational sign-ons to this letter, since it's a federal advocacy issue. So if you think that your organization might be willing to sign on, they're collecting those through the end of this week. I also just wanted to give folks a heads up that the Illinois General Assembly will be starting their session soon, and there are a number of policy issues, as you all know, that touch on the areas that we've been discussing today, that the General Assembly will be taking up. In particular, as folks know, there was some great success with passing some of the legislative Black Caucus's agenda during the January session, particularly around criminal justice. However, some of the other bills that that the Black Caucus had brought, particularly the health bill, was not able to be passed during that session. So most of those provisions are going to be reintroduced during the upcoming legislative sessions. So we'll be keeping people posted about specific advocacy opportunities over email. One issue of potential, or 2 issues of potential interest to this group, I already mentioned the community health worker piece earlier, and then also related to something that Vanessa and others brought up around housing. We know that there's a need for more work around eviction prevention and policy work to make sure that we have strong eviction prevention measures in place in both the city and statewide. So there will be a bill that will be reintroduced in the General Assembly around eviction prevention, and we'll make sure to send that information around if people want to get involved with advocacy on that as well.
Thanks so much, Jess. I'll pass it over to Holly. I know you had a quick announcement.
Thanks, Rebecca. I just wanted to mention to everyone that Northwestern has been partnering with one of our community partners, Bright Star Community Outreach, to produce a video series called Clergy and Clinicians. So we've done a few sessions to date on various health topics, and our 2 sessions coming up are going to be addressing the COVID vaccine and the African American community, and then we're also going to be branching out to other faith organizations beyond BSCO to address the COVID vaccine and myths and facts within the Latinx community. So it's just a really nice opportunity to help spread the word and increase awareness among the community members around the vaccine. I know that there's a lot of different ways that folks are going to need to receive this information from trusted health leaders, trusted clinicians, their neighbors, their family members. So this is just another thing to add to the arsenal of education topics, and I can share the link with the group after the meeting.
Thanks so much, Holly. And yeah, we'll be sure to also pass out that link in the notes after the meeting too. Any other final announcements before we kind of close out? I know we're getting close to the 11 o'clock mark. Okay, so thank you guys so much for taking the time to be here with us today. We had such a really rich conversation. I want to thank Vanessa and Dr. Walker again for taking their time to share their expertise and their experiences and some of their visions for moving forward. There is a lot that we can do together, and we're happy to continue to have these conversations if that is helpful, and continue to kind of challenge each other and push forward in thinking about how to really truly collaborate. I just want to put a reminder that our next meeting will be May 6th at 10 a.m. Until then, we'll definitely shoot you a reminder to remind you. But feel free to reach out in the meantime and continue this conversation. And thank you again so much for your time.
Thank you.